A very welcome to all of you that you have taken the initiative to learn psychology. I am here Dr. T. N. Debnath, a doctor of modern medical science, motivational speaker and लाइफ कोच. आज इस वीडियो में हम लोग देखेंगे साइकोलॉजी में कैसे हम लोग खुद को और ज़्यादा इम्प्रूव कर सकते हैं. इसके बारे में इस वीडियो में हम डिटेल्स बात करेंगे. शुरू करते हैं. आज के टॉपिक क्या हम लोग इस वीडियो में देखेंगे. ये मॉड्यूल में हम लोग देखेंगे साइको एडुकेशन के बारे में हम लोग डिटेल्स बात करेंगे. सपोर्टिव साइकोथेरेपी, एक्टिव एम्पैथेटिक लिसनिंग, कॉग्निटिव बिहेवियरल स्ट्रेटजीज, व्हाट इज स्कीमास एंड बिहेवियरल स्ट्रेटजीज फॉर कॉमन मेंटल डिसऑर्डर एंड एंजाइटी डिसऑर्डर. So these are the topic we'll discuss, but I will try to discuss each and every topic in a very short time, number one, and number two, in a very easy understandable way, so that you get very energetic to learn the subject and you get the interest simultaneously to learn the subject. So in today's video I will talk only about psychoeducation. What is psychoeducation? Why psychoeducation is important, and how we can apply this psychoeducation to psychological or psychiatric illnesses. That is a very crucial area. Actually, we often misses in our classes that psychoeducation part is very important. So let us start with psychoeducation. Now, in psychoeducation, what will be our learning objectives? Now, लर्निंग ऑब्जेक्टिव्स, नंबर वन साइको एजुकेशन क्या है, नंबर टू कैसे, व्हाट आर द स्टेप्स, हाउ विल डू द साइको एजुकेशन एंड हाउ वी कैन अप्लाई दिस साइको एजुकेशन इन आवर क्लिनिकल प्रैक्टिसेस, मतलब इन योर क्लिनिकल प्रैक्टिसेस ऑल्सो. रिमेंबर, साइको एजुकेशन इट्स a skill, very important skill of clinician. That's why you are here, to learn the psycho education, to learn the skill, because this is very very important and it is very effective as well as very much necessary for all the medical field, and especially the psychiatric illnesses or long term illnesses, right? Remember, it is not an ordinary health education, क्योंकि हेल्थ एजुकेशन आपको बहुत इजीली मिल जाता है. कोई भी आदमी आपको एडुकेट करेंगे या फिर आपको मेडिकल के बारे में बात करेंगे, तो इट इज़ नॉट an easy actually ordinary health education, rather it is a skill task मतलब है you have to learn it, right? So if you have very good psycho education skill, you can build up repo very well. And remember that repo is so important, because that repo will give you the compliance means how the patient will take the medication or take your words very seriously. Now, compliance definitely depends on your repo. If you have built up very good repo, definitely that patient will be compliant to you. It's not only about the medication. Compliance means in the further session, like if your repo is not good, no, that patient will not come for your follow-up, not come for the further sessions. Right? So that repo is very important for compliance of the medication, compliance of the therapist, like therapeutic sessions, and it will definitely will determine the treatment outcome. So psycho education is so important. Psycho education, it will help in build up the repo, and that repo will give you the compliance, and that compliance will definitely will have very good treatment outcome. That's why it is very important, because you are a budding साइकोलॉजिस्ट, यू आर गोइंग टू ओपन योर ओन क्लिनिक. नाउ इसमें सबसे इम्पॉर्टेंट है कि आप पेशेंट को कैसे सेटिस्फाई कर सकते हैं, पेशेंट का क्या क्या प्रॉब्लम आपको सॉल्व करना होगा, क्योंकि जब तक आपका रेपो बिल्डअप नहीं होगा, तब तक पेशेंट का ट्रस्ट बिल्डअप नहीं होगा, तब तक आपका ट्रीटमेंट का इफेक्टिविटी आप नहीं देख पाएंगे, पेशेंट का सिंसियरिटी आपको नहीं देखने को मिलेगा. इसीलिए ये बहुत इंपॉर्टेंट है. Now, what are the steps of psychoeducation? Now, the most and very important point, that is understanding the patient's perspective about the illness. जो भी illness है, इस इलनेस के बारे में पेशेंट का क्या पर्सपेक्टिव है, that is very very important. Actually most of the doctors, busy doctors, actually they fail to understand the patient's perspective. It's very important, very important, because unless and until you can understand the patient's perspective about this illness, it will be very difficult for getting a very good result or very good outcome, right? Now it is actually the patient's model. We perspective, actually it is the patient model. Now I will give you an example, and we will try to understand how this model or how this patient perspective is very very important for the treatment, right? So number one, see, there is an example of car accident, and both the drivers died. Both the driver dead. Okay. Now how that situation can be explained? Now that someone can explain that both he or she can blame the both the driver. Yes. Number one, we can say it is a very unfortunate accident. Yes. Someone can say it is a general bad driving. Definitely it is a bad driving, that's why there is accident. Now some may think it is a bad karma. Okay. Someone may think it is a evil spirit. Now see, the accident, car accident, that is the incident is the same. Incident is the same. But if you see, if you look at the expression or how they explain the situation, it's different. That's why it's very important to know the patient perspective about the illnesses, especially the psychiatric illnesses, and we call it as a explanatory model. How they explain their problem, how can they explain their symptoms, and everyone has his own model of explanation, and it may or may not be true. This how they explain, it may not be correct, it may be correct, it may not be correct, but remember this is the patient's perspective. Now similarly, if you give one example like psychiatric illnesses, any kind of psychiatric illnesses, most of the psychiatric illnesses are long term, so patient and family will have some model to explain their symptoms and problem. Now, any family or any patient have mental illnesses, now they will try to explain their own way, own explanatory model, own perspective to this illness. Now being a therapist, you have to understand, you have to listen them, so that you can understand the patient's perspective, which actually most of the doctors, most of the therapists actually ignore this part. This is the very important part. I am telling you, whatever you are, this part is very very important. If you have very good hand on it, or you have a very good skill on it, definitely you can build up a very good repo. Definitely that patient will be very well with you, very much satisfied with your treatment. They will go, they will say that the therapist or doctor is very good, and definitely this is it will be very good in the market. You will have name and fame, and definitely the patient flow will increase. So that's why don't ignore this part. This part is very very important to understand the patient's perspective. Now therapist, being a therapist, being a doctor, we might have some other model of expression or explanation, right? So patient perspective may be different, or may be same to the doctor, or may be different. Now if you see, the patient's perspective is different and doctor's perspective is different. Now that difference will leads to miscommunication, right? Miscommunication, misunderstanding, right? Poor repo, definitely repo build up nahi hoga. Once there is poor repo, there will be poor compliance. Once there is poor compliance, there will be treatment failure. So in treatment failure, we need to understand that what is the patient's perspective. Like, to make it more clear, let me give another example. Like in psychosis, we all know patient talks irrelevant. Patient sees something which actually cannot be seen by others, or hears something where patient can no one else can hear these things, these voices, right? That is basically a psychotic features, we can say. Now that psychotic feature, that feature actually, if you see someone is telling that there is a god, there is a evil spirit, and no one can see, what will think, what a patient or what a patient party will think about? Definitely they will think about the evil spirit or something bad, right? So definitely once there is evil spirit, they will never come to the doctor, they will go to the magic healer. And that's why we have seen most of the patient in the periphery of the country, or periphery of the state or district, whatever you can see, we can see that most of the people, they goes to magic healer first, then they come back to the doctor, right? And very few, they will have medical they will have that model or the perspective that it is a medical problem, so we need to go to the doctor. They will take the treatment, they will continue the treatment, and their outcome will be better. Now in that case, there will be going to the magic healer, and ultimately when it will not work for them, they will definitely come to the doctor. So before coming to the doctor, most of the psychiatric patient actually they visit to the magic healer. Now here some of the family might have both this model, like one of the this spirit or evil spirit or magic healer, that is model is there. Number two, medical problem, that is medical model is there. Now they will, for the medical problem, they will come to the doctor, as well as they have a belief or faith on the magical healer, so definitely they will go for magic healer also. Now here they will continue both the model, that's why you call it multiple model. Both the model, medical model as well as the evil spirit, that is another model. So both the model they will present, so they will definitely they will take the treatment, but similarly simultaneously they will go they will continue the treatment from the magical healer also. So here most important part, you need to understand that they don't try to break the belief of this patient very early. At the first session, you never try to break their belief, right? So you will lose the patient. So if patient is doing the multiple model, right, they will take the treatment as well as the medical healer. Here the crucial point is that you ask them, yes, you can continue that magical healer treatment or whatever you can do, but never stop the medication without doctor's permission, right? Sometimes that magical healer will say no need to take the medication, they will not take the medication. So this part need to be understood by the doctor as well as the this patient party, that at any cost we cannot stop the medication without doctor's permission, right? So this is the important of this psychoeducation and understanding the patient's perspective. Now see, in the alcohol dependence, in a state of like Assam, Dibrugarh, there is a very prevalence, or much more cases are there of alcohol in dependence, right? In alcohol dependence, most of the patients, they think actually it is just like a simple problem. They come to the doctor and they say, give me some pill to become earlier or faster, right? So they think it's a very simple problem, that one medicine or two medicine will fix their problem, they will go and they will do their work, right? But actually if you see, in according to the therapist or doctor, we know that alcohol problem is dependence problem is not a very simple problem. It needs long term treatment, it needs motivation, it needs social support. That means we need holistic approach, right? Then only we can stop their alcohol dependence. Otherwise what, as they think it is a simple problem, so they treat this problem as a simple problem only, no? So they will just take the medication, they will feel better, they will stop the medication, and again after few months or 5 to 6 months, they will come to the hospital again, they need to hospitalize. So this is the problem, because patient's perspective is not understood by very well, right? If he has a perspective of that alcohol dependence is a simple problem, now this is the importance of the psychologist, that we need to understand, we make them understand that actually it is not a very simple problem, and we need holistic approach, we need long term dedication, support, and then only we can terminate this problem. Unless and until we have to have patient will have readmission in the hospital again and again, right? Now once we understand the patient's model, now we need to express our own model. That means that is the medical model. What is the medical knowledge or the medical cause behind this sign and symptoms? This is very important to make them understand. So to make them understand, what we'll do, try to explain in a very simple way, in a very easy way, in an acceptable manner, in an understandable manner, right? We cannot use the hi-fi word, actually that medical word, we cannot use this word to make them understand. So we need to make them understand in their own language in a very easy manner. And now in an example I will give you, like in epilepsy and seizure. In epilepsy and seizure, we see most of the time in the alcohol withdrawal seizure, we'll see some of the children might come with a seizure disorder, some of the patient may go to the neurology, whatever, but psychology and psychologist is very important. Now this can be explained. How we can better explain? If I say that is seizure or epilepsy, most of the patient usually staying in the periphery, and they will not understand. Now we can tell them that actually our brain is just like a electric wiring. No, so much of electric wire is there in our brain. Now if there is anywhere there is current excessive current is there, so it will cause actually some problem in the brain, and it will express as a movement disorder, as an abnormal movement, that is actually seizure. Now we need to make them understand that actually it is not because of the evil spirit, right? It's because of the any abnormality in our brain, in the circuit of the our brain, where the electric current that passes in a very haphazard manner, and it will cause that seizure, is cause that abnormal movement. Then they will understand, okay, it is like that only. So how we can manage them? Now you explain them that can be managed by the medication, and that medication needs to continue, and it cannot be stopped without doctor's prescription or advice. It is very important to make them understand that seizure is because of this problem, and you need to continue this medication. That medication will definitely help to not to have such so much of seizure, right? So this is the very important message you need to give them, need to make them understand that actually the problem is there, and behind this problem, that is the knowledge, and due to this abnormality, actually we are seeing some abnormal movement or any other symptoms. You can explain this in a very easy way, right? So that they can understand very in their own language, in their own way, and in their acceptable manner. You have to give them, okay, then only they will understand and they will follow you. Now once you have given your own perspective about the illnesses, now it's very it is now third step is check for the understanding, whether they have understood or not. Now you can ask, could you please tell me what you have understood from our discussion? Now they will try to explain actually what happened and why it is happening. If there is any doubt, you need to break them down, you need to make them understand, and you can explain it again, right? Remember that psychotherapy is not a one time task, is not a one session activity. You need multiple sessions for that. You can understand, you can make them understand, because unless and until the patient and patient party does not understand why that is happening and how it can be treated or managed, then you can expect very good result. But if they understand, if involved in their treatment, definitely you will have a very good outcome. So being a psychologist, you need to understand that psycho education is very important. Psycho education is very important. It will give you the repo building, it will give you repo building. Psycho education, right? Psycho education. And being a psychiatrist or psychologist, remember that psycho education, understanding the patient perspective, understanding the patient's perspective about the illnesses, number one. Number two, understanding, make them understand your that is medical, you have medical knowledge, so your medical model, you can explain them why the problem is happening. And number three, you can try to get whether they have understood or not. If they have not understood or any doubt is there, you can clarify them. So if you have a very good skill on psycho education, remember your patient will love you. Definitely one patient will bring you more patient. You will have a very good name and fame in the society, that you are a very good doctor or very good psychotherapist. And remember, this psycho education, though it is very simple, remember it is very effective. It will give you very good treatment outcome, and your earning also. So definitely don't ignore this psycho education part. Always try to make understand the patient perspective, your perspective, let them understand. And number three, you check for this, and subsequently we can subsequent videos we can talk about this other topics of this module. In this module, we know we have talked about the psychoeducation, and next video we'll talk about the supportive psychotherapy, and how active empathetic listening is done, and how much it is important, how you can you can have a very good repo with this. And the number 3, cognitive behavioral strategies. What are those? And schemas. What is schema? We'll talk about in details. And behavioral strategies, how we can change the behavior so that common mental disorder can be handled very well. And in anxiety disorder, what are the behavioral strategy we can use so that we can have a very good treatment outcome, as well as very good repo with the patient, and very good repo in the society, being a very good psychotherapist. And with this, I am concluding this session, and in next video we'll talk about the supportive psychotherapy and active listening, and other behavioral studies. If possible, we will try to continue. And thank you for purchasing my course, downloading my app, and definitely I can assure you, whatever you invest here, you will get a very good return from this. Thank you so much.